First of all, I think it's a really easy technique to learn and to teach. Teaching my nurse hysteroscopist to use this and the GP hysteroscopist that I work with, and it's a nice simple technique. The other thing about it is because it works on impedance, it doesn't matter how thick your endometrium is when you treat somebody, and it's particularly relevant for our population because obesity is a big issue, and in obese women their endometrium can be really thick. And if you're using first or second generation technique, then sometimes there's a failure because that endometrium's too thick. The NovaSure gets over that because it works out exactly how much endometrium it needs to treat. No matter whether it's 1 millimetre or 20 millimetres thick, it'll still work.
Yeah, so I've started using NovaSure, as I said, a number of years ago now, and one of the things that attracted me to using it was, one, its simplicity of use, and also that I thought it had some number of safety features which, with the current techniques that I had been using, were not present, and therefore I thought the safety aspects of the NovaSure technique was one of the major factors. It also seemed to have very good results in most of the clinical trials, and indeed in my practice that has been the case. The results have been very good, and we've not had any problems from a safety aspect. I think therefore it's beneficial to the patients we've been treating. Okay, the most important aspects of the NovaSure technique really as a consultant are its safety, and I think the cavity assessment is very important and allows you some degree of safety that you know that you're in the right place, you know that you've not perforated the uterus. I think from the patient's point of view, it's a very quick technique which is helpful through theatre, it's helpful for those practicing the technique, and it's helpful probably for the hospital as well. I think those things put together, knowing that its effectiveness is good, mean that it's a very useful technique for endometrial ablation.
In terms of effectiveness of the NovaSure procedure, we've done a trial now over the last year comparing the NovaSure to other established ablative techniques, and we found that the NovaSure seems to be much more effective and more patient-friendly than other techniques.